Bismillahirrahmanirrahim. Assalamu alaikum, my dear students. I hope all of you are in the best of your health. Today we'll be covering the second last topic of the whole pharmacology, and that is locally acting drugs. Supposedly, this lecture was to be taught with general pharmacology, but since you were not familiar with many drugs, but now you have finished all the course, and we'll be just telling you the names of those drugs which you have already done, and some of them you are already using them in your daily life. So it's a very interesting type of lecture, and tell you one thing more, that this is a very important topic from the Viva point of view, especially when Professor Maqsood takes the professional exam Viva. Then these questions are repeatedly asked, especially like he asks, okay, which drugs they have emollient actions, or what are astringents, or what are the pigment containing drugs, and others I'll be discussing with you. So let's move on to today's presentation. Emulsions. The agents that form soothing film over a mucous membrane, relieving minor pain and inflammation of the membrane. So they are basically mucoprotective agents. As the name is indicating, they are protecting the mucous membrane. How? By forming a soothing film. Examples, we have gum acacia, gum tragacanth, lycorizia. For example, in the cough lozenges which you take like strepsils, methyl cellulose nose drops, glycerine. Many of you have must have the skin disease in which there is eczema or dryness. Then you apply the glycerine. Then we have propylene glycol, which have an exclusive dressing for echinosis, which is a skin disease, which I'll be sharing you in the other upcoming slides. Then we have emollients. I'm again and again emphasizing that you must be familiar with these terminologies. It is a frequently asked question in the Viva. So these are bland, oily substances which soften and moisturize the skin. Form an occlusive film over skin and thus prevent evaporation, so prevents dryness of skin. I hope you are all coming to the point, okay, what would be the examples of these drugs? They are protective and softening agents. They act as humectants and also used as vehicles. Yes, the biggest example is of Vaseline petroleum jelly. So, vegetable oils like olive oil, linseed oil. In animal products, we have beeswax and lard. And petroleum products, we have petrolatum and liquid paraffin. This is a very important, commonly used example of these agents. Astringents. They precipitate surface proteins but don't penetrate the cells, affecting superficial layers only. And they toughen surface, making it mechanically stronger and decrease the exudation. Examples, we have tannic acid and tannins. We have alcohol like ethanol and methanol, and mineral astringents like aluminum and zinc salts. We have irritants. Irritants can be defined as those agents that stimulate sensory nerve endings and induce inflammation at the site of application. So as the name is indicating, it's going to irritate the local area. Depending upon their nature, the concentration and sensitivity of site they produce. What are their effects? They either produce warmth or cooling sensation, picking or tickling, hyperesthesia or numbness, and local vasodilation. These are the effects of the irritants. Various types of irritants like rubefacient, they, as the name is indicating, rubor means redness, so they cause local hyperemia. For example, mustard seeds. Then we have vesicants, stronger irritants leading to blister formation, for example, mustard gas and cantharidin. And another terminology is counter-irritant. Substance that cause irritation or mild inflammation of skin or relieving pain in muscles, joints, and viscera. For example, camphor, menthol, clove oil, thiamol, methyl salicylate, and capsaicin. So you must be familiar with these like vapor ups, the Tiger Balm or the Iodex, especially when um, elderly people living with us, our grandparents, they have usually problem of osteoarthritis or back pain or any other sort of pain. So they are usually applying these, doing these remedies. So this is very important because these are the all the things which are using in your daily life. So you must be knowing what are we calling them in pharmacological terminology. We have keratolytics, and these are the agents that soften and facilitate exfoliation of epidermal cells, that is, they remove excess keratin. Thus, the name is indicating keratolytics. Used as hyperkeratotic lesions like corns, warts, keratodermas, and athlete's foot. And these terminologies you must be familiar with corns, especially in the feet. Wearing the closed shoes for a longer period of time, it gets this condition. Then we have athlete's foot. And examples of these drugs of salicylic acid, 3 to 6%, urea, resveratrol, propylene glycol. Then we have sunscreens. This is the most popular uh, small thing which especially the girls carry out whenever they have to go outside, and as they are very beauty conscious, so sunscreen means which I usually carry for to prevent yourself from the excessive sunlight. Okay, so substances that protect the skin from harmful effects of sunlight exposure by absorbing or reflecting UV light, they are called sunscreens. They are physical sunscreens like opaque substances that reflect sunlight, prevent sunburn and tanning, and useful in patients with photoallergy, and examples are zinc oxide. Then we have chemical sunscreens like compounds that absorb UV light, prevent sunburn and phototoxicity, but tanning does occur. Used as adjuncts in melasma and vitiligo therapy, prevent premature aging and skin cancers. Examples of the chemical sunscreens are PABA and its esters, benzophenones, and dibenzomethylmethanes. So these are the examples of various sunscreens which are chemical in nature. We have agents that affect the pigmentation, like melanizing agents. Drugs that increase sensitivity to solar radiation and promote repigmentation of vitiliginous skin. I hope you all know what is vitiligo. And this is example is sorilacine on photoactivation stimulates melanocytes and induce their proliferation. And we have demelanizing agents, and as it's self-explanatory that these lighten the hyperpigmented patches on the skin, demelanizing, right? So the examples are hydroquinone and meconyl, azelaic, glycolic, kojic, and lactic acid. Then we have tretinoine, monobenzone, which causes irreversible depigmentation. And I hope you all must be familiar with this classical example of demelanizing agent. As you can see, the previous Michael Jackson and the latest version. So these are the therapies which are behind this transformation of Michael Jackson. Then we have agents affecting the hair growth, which are also called anti-trichogenic agents, which are those which reduce hair growth. And one of the example is eflornithine, right? So in this context, if I can recall, there are drugs which are causing hypertrichosis, increased hair growth on the unwanted body parts. So that was minoxidil, which causes hypertrichosis, and this is used also as one of the agents for the male pattern baldness. Okay, it's a very important MCQ and the clinical use as well. But over here, the reverse is happening, the agents that reduce the hair growth. And here comes the example of minoxidil, the agents which cause increased hair growth or promote the hair growth are called trichogenic agents. And the classical example is that of minoxidil. And we also have like, as you can see in the picture of eyelashes, there is increased hair growth on the below picture, in which we have example of bimatoprost. We have antipruritic agents. As you all know, okay, what is pruritus? That's extreme itching. So these agents, they prevent or relieve the itching. Okay, so we have antihistaminergic drugs like H1 antagonist, and treatment of pruritus is associated with atopic dermatitis and lichen simplex chronicus. And we have certain drugs like topical anesthetics. Also have camphor, menthol, corticosteroids, and crotamyton. And you must be familiar with the famous prickly heat powder as well, that also comes in the category of antipruritic agents. And pruritus is usually as a part of some systemic disease as well, or some sort of allergic reaction like some insect bite or anything. Then you have to relieve that allergy, so you give H1 antagonist. Then we have antisephoric agents, which are to treat the seborrheic dermatitis. In other words, we say the excessive uh, dryness, which is leading to dandruff in the hair, and also it affects the various parts of the body when it is affecting the whole body, not only the scalp. So example, we have selenium sulfide, and it comes with the trade name of Selsun yellow shampoo, which is a very old, well-known shampoo used by many of us as well, and that then came the Selsun blue as well. We have zinc, pyrethon, corticosteroids, imidazolone, antifungals like ketoconazole. We have coal tar, sulfur, bisoprolol, salicylic acid, and which are mildly effective. So you must be, the basic theme of this lecture is that you must know the terminologies. What are emollients? What are demulcents? What are antipruritic agents? What are demelanizing agents? What is seborrheic dermatitis and how do we treat it? So this is very important to get acquainted with these terminologies, because these are just you see these things which are used daily by all of us in one way or the other. Then we have anti-acne agents. For mild to moderate acne, we give topical antibiotics like clindamycin, erythromycin, metronidazole, sulfacetamide, and dapsone. Then we have benzoyl peroxide, we have retinoic acid and its derivatives like tretinoine and azelaic acid. So these are the drugs for the treatment of acne, and many of you at this age group have acne at its peak, because at time it is usually related to hormonal changes. And as you can see, there's acne and the transformation of the scars. Then another terminology which is a pet favorite of your sir, which is parasites, which are agents used to kill parasites like scabies, pediculosis. Like, you know what is lice? See? So this is pediculosis, scabies, which you have already done in your practical, like sulfur ointment that is used for the treatment of scabies. So examples are permethrin, lindane, benzyl benzoate, crotamyton, sulfur, and malathion, right? So malathion you must have covered, if you can recall, from the organophosphorus compound when we discussed about parathion and malathion. And I also told you there's a very important MCQ sometime asked which one is more toxic in mammals. So I told you earlier, okay, M for mammal, M for malathion, which is comparatively safe than parathion. Topical corticosteroids, they act as anti-inflammatory agents in different dermatological conditions like eczema, psoriasis, lichen planus. Examples are hydrocortisone, methylprednisolone, betamethasone, dexamethasone, and triamcinolone. These are examples of corticosteroids. And you all must be knowing by this time, after going through whole of the pharmacology, there are so many clinical use of corticosteroids. So this is, we are since studying about the locally acting drugs, so we will discussing the topical agents in this topic. With that, we end today's lecture, and this was the last lecture from my side for you, and I wish you all the best for your upcoming exams when the college reopens, inshallah. and we'll be displaying the schedule, but in a very quick recall, I must tell you that your test would be conducted in 4 steps. The first part would be 1/3 course of pharmacology, then another 1/3, and then another, and then there would be a full book test of pharmacology, and that test would be comprising of short essay questions only. Since we have taken lots of vivas of you people, and we have also taken your MCQ test, but there is no nothing much better than the SEQs, because in exam also the more weightage is given to the short essay question. So you must be familiar with this practice of attempting the question within the time limit. So we are planning to conduct this, and we'll be sharing the schedule with you soon. And I'll be giving you assignment in a couple of minutes. And best of luck with your studies, and go through the lecture and go through all of the lectures. You have been very good students, but we have also worked very hard for through this online system. So kindly students, work hard and don't let waste all the energy and time you have put for this whole system. And inshallah, Allah will be with us, and Allah help us so that we are successful in teaching you people, and you give us good results, and I hope for the best. And Allah Hafiz. Bye bye.